Hello and welcome to the second half of AOTA's Federal Capitol Hill briefing. Today, Tim Nanof, Federal Affairs Manager, and Ralph Kohl, Legislative Representative, are going to go over the current issues that you're going to be talking about when you go to visit Capitol Hill offices on October 5th. These are the basic issues, and as you can see, they're really only two, but they're very all-encompassing. Healthcare reform is the context of what's going on Capitol Hill right now, and it's critically important that you focus on these particular aspects of health reform so we can all have a coordinated message. Second, and probably most importantly, it's critical that you explain what occupational therapy is, providing specific examples and district-specific information whenever you can. That's the biggest thing that you're going to be able to accomplish getting across in your meetings, is to actually have them better understand and appreciate occupational therapy. So we'll start there, and as you can see, it's important to explain what occupational therapy is in a simple way that everyone can understand. The sign that these two girls have at the Today Show is OT helps people of all ages learn and regain skills that help them be independent. That's a quick statement that everyone can understand, and then in a follow-up, you can talk to them about specific things that you do, types of interventions. Give an example. If you work with children, talk about some sort of pediatric intervention you might do. If you work with seniors, focus on stroke or something that's commonly understood by the average person about what the potential consequences are and how OT could help with that. If you can, talk about things specific to the district or the state. Talk about the hospital, the clinic, or the school that you work in, or the school that you go to. Try to avoid using OT jargon. A lot of people on the Hill don't understand a lot of medical terms, but just break it down like the two women above did. I want to quickly go over AOTA's principles for healthcare reform. These came from RA task groups and were approved by the RA back in 2007. These are general sort of overarching principles that we shared with Congress, and particularly with the committees that have jurisdiction over healthcare last year. And they continue to guide AOTA's focus on advocacy. Healthcare must have a proactive prevention focus, and we're seeing that in all the bills that are out there, particularly in Medicare, where they're removing some of the co-payments for preventive services. Healthcare should be available in all settings, including where people live, work, and participate. Occupational therapy should be covered to provide preventive, rehabilitation, and habilitation services. We're going to talk a little bit more about that in a coming slide, because that's an important area that we're going to advocate for on Hill Day. And access to affordable health care should be the goal of reform. That's really critical, that we do believe at AOTA that access to health care for those 45 to 49 million people who are currently uninsured is critical. All right, now we're going to go specifically into the issues we're going to talk about, and it's all in the context of health reform, and there's a lot to talk about. First of all, we want to protect reimbursement for Medicare and Medicaid. Particularly Medicare is targeted with some pretty significant cuts for hundreds of billions of dollars in overall spending, and most targeted of those groups are skilled nursing facilities and home health agencies, both of which are big areas of practice for occupational therapists, as most of us know. Outpatient services are also targeted for some cuts, so we're concerned about these big picture items that will affect occupational therapy as well as these other particular settings. The bill also does some important things that are good in Medicare as well. For example, they address the therapy cap and extend the current exceptions process for another 2 years, allowing us to work on other important issues and making sure that people can still get access to the therapy they need. The overall physician fee schedule, how all providers under Medicare get paid, is scheduled to get a 20% cut this year. And the plan is to eliminate that cut with this health reform bill and provide a small update of roughly 1%. So that would be an important factor for all providers and beneficiaries to ensure they continue to get access to Medicare services. Medicaid is expanded to 133% of poverty, and that is very good for low-income families and children in particular. And it also, the bill in the House extends early periodic screening, diagnosis, and treatment services, EPSDT services, that mandate access to developmental services like occupational therapy for all children on Medicaid. In the House, they extend that to all children under any of the proposed plans, and that's obviously something that would be very important for occupational therapy and provide access to all children across all different plans. We want to ensure access to rehabilitation, and this is getting back to what I said before about making sure that there is access to rehab. The Senate Help Committee, the Health, Education, Labor, and Pensions Committee, as well as the House bill, have an explicit inclusion of rehabilitation, habilitation, and devices in their bill, required categories of services. The Senate Finance Committee at this time does not have that particular category. Now again, that doesn't mean that OT wouldn't be covered. We would be covered under hospital services, under outpatient services, but they don't have a specific rehabilitation category in the Senate Finance bill right now. And we've worked very closely with Senator Sherrod Brown's office from Ohio and Senator Patty Murray's office from Washington to make sure that rehabilitation is included in the Senate Finance bill as a required category. This is really important because it says a lot about what the focus of the plans are and where they're going to direct their services. We're also collaborating with the Consortium for Citizens with Disability, which is a large national coalition of consumer and provider organizations that focuses on how legislation would impact people with disabilities. And they're very strongly pushing this as well, although AOTA is one of the most prominent groups out there fighting for this. So we ask that when you talk to Senate offices in particular, and you can mention it even to House offices, but let them know that it's important to have a required category of service that includes rehabilitation, habilitation, and devices. And by that devices, we mean assisted devices, as you see in the slide there, but also things like wheelchairs and any kind of durable medical equipment. Excuse me. At this point, I'm going to turn it over to Ralph Kohl to talk a little bit about workforce issues.